Hello, everyone. Welcome to class. Welcome to lesson 6. This week we'll be covering 2 chapters again. We'll be talking about the feeding and eating disorders in chapter 8. And then we'll be in chapter 10 talking about some substance-related disorders and addictive disorders. So hopefully you're continuing to check the syllabus for when things are due and continuing your good work on the discussion boards. Thank you very much for that, all your good work. Again, if you have any questions, please reach out to me via email. Most of you seem to be doing really well in the class. Congratulations. So let's start our chapters so that we can get through what we need to do today. Start with chapter 8. Here we go. So when we're talking about eating and feeding disorders, we think of 2 general disorders that are kind of popular or we've heard about at least, and that is anorexia and that is bulimia. We're going to talk a little bit about some of the theories behind this, on how people think about the eating disorders and how we get them and how we can treat them and psychologically and using medications. So let's quickly run through anorexia. If you're interested in this, there's lots more information in our textbook and of course tons of it on the internet. Please be curious about the eating and feeding disorders. There's some really interesting research out there about how things can go wrong psychologically with these disorders. So anorexia is basically a condition marked by restriction of energy intake, food, liquids, relatively to the needed requirements of our bodies. There's a low body weight in context of age and sex and developmental aspects, and there's usually some physical health issues involved in it. Most people that are suffering long-term from anorexia are severely underweight for their age and height. They have a really low body mass index, and there's 2 types of anorexia: restrictive, where they restrict the calories that they take in, and they increase physical activity to burn the calories that they do bring in. And then there's the eating, binge, and purging type of anorexia. Most thoughts occur when we talk to people who are suffering from this disorder. They have an intense fear of becoming overweight, even though they are severely underweight at the time. Two common symptoms of anorexia that happen, one for women is that they lose their menstrual periods for sometimes at least 3 consecutive months, and because of the lack of calories that their bodies are taking in. Depression is a comorbid diagnosis, and anxiety is often also present in anorexia. So when we look at the people who suffer from anorexia, we see some personality traits that are a pattern for this disorder, and that is perfectionism. There's some obsession aspects to them, to their personalities, and some neuroticism, which is basically they worry a lot about what's happening in their lives. So bulimia is basically a binge eating disorder with recurrent um, compensatory behaviors. So there's a eating a lot and then somehow compensating for eating that. There's a lack of control over the binge episodes and also for the compensatory behaviors. Oftentimes, people with bulimia will have a usual or normal weight, or they might be slightly overweight. Most people with bulimia or anorexia feel a stigma or shame regarding their disorder, and will deny the behaviors around this disorder. There is a mortality rate of about 4% for people with bulimia, and it seems to be somewhat high. When you think about 4% of the people who have it actually die from bulimia. So the binge eating disorder was first recognized in 1959, not that long ago. And this is a kind of a binge eating behavior, but without the inappropriate compensatory behaviors. In other words, this is just eating a lot and obsessive thoughts around that, around eating a much higher caloric value than others. It's found in some obese individuals, higher rate for females than males. So other specified feeding and eating disorders is a catch little area of contained different diagnoses that have to do with eating and feeding, but don't quite fit anorexia or bulimia. And you see some of them here. So eating and feeding disorders of childhood, pica, is considered something that children do where they were eating um, things that are not considered food, non-food substances, or something that has no nutritional value. Could be like paper, could be anything that is not food. Um, uh, we're not quite sure if this is actually a deficiency in some minerals or it is just a developmental disorder that happens. Rumination disorder is when recently eaten food is regurgitated and then rechewed and reswallowed and then spit out. Um, and we see this in some people who are suffering from this rumination disorder. Anorexia and bulimia is more common in women, um, and we don't really have any clear picture on some kind of racial or ethnic distribution or demographics when it comes to these disorders. Research is showing us some interactions between serotonin and the dopamine systems in our bodies and brains are associated with some of the personality features that we see in eating and feeding disorders. So we're not quite sure if this correlation is a cause or just something that we see together. It seems from family and genetic studies that anorexia, bulimia run in families, along with binge eating disorder. Psychodynamic Freudian perspective on anorexia is basically it's an attempt of a behavior to defend against the anxiety associated with emerging adult sexuality. Um, they come up with this because a lot of the anorexic disorders start to happen pre-adolescent for females when their sexuality is emerging. Again, a correlation, not a causation. Um, as far as treatment goes, oftentimes inpatient treatment is necessary for anorexia and for bulimia. Um, it requires sometimes quite a bit of intensive treatment to help the person start to um, um, regain the weight that they've lost. Again, here's our good friend, cognitive behavioral therapy used to help for the eating and feeding disorder and changing the patterns in their thinking and the behaviors. Oftentimes, we'll see, especially if we're treating pre-adolescents or adolescents, that family-based therapy, family therapy, where everyone in the family is brought in, can help change the dysfunctional family systems that may have brought on these eating and feeding disorders, and getting everyone in the family on board as far as helping take the pressure off of the person who is experiencing the symptoms. And we've come to the end of our chapter. All right, everyone, keep up. Sometimes it's the hardest part of the semester term to keep going, but keep going. Thank you so much for your effort and your hard work. I really, really appreciate it. I will see you next week.